Jay, with President Obama's reform to health care, insurance companies are feeling the burden of recent changes. But how will the Affordable Care Act affect insurance coverage for Americans? Local medical professionals provided an insight to the changing face of the insurance industry. Doctors and patients aren't the only players in President Obama's health care reform. Under the Affordable Care Act, insurance companies are also taking a pay cut for Medicaid and Medicare programs.
They have to use 80 to 85% of the premiums that they receive towards health care, so there's not as much padding there for them.
On February 16th, the federally run Pre-Existing Condition Insurance Plan suspended acceptance of new enrollment. PCIP was created as a transitional insurance program to cover pre-existing conditions for patients before the 2014 implementation of the Affordable Care Act. Insurance companies are also required to cover certain preventative care services without cost sharing.
In the past, the insurance companies did not have to provide preventative care services. With the health care reform changes, the insurance company is now required to provide that preventative care.
Dr. Carmen Pearl says insurance companies' profits have soared in the past few years. With new health care laws, patients may be at the mercy of higher insurance premiums.
And the only people really making money in this last decade have been the insurance companies, and their premiums are going higher and higher. The patients' co-pays and out-of-pocket expenses are going higher and higher.
For Dr. Pearl, the role of insurance companies has become an inhibiting factor in providing adequate health care for patients.
The other thing that I think is getting frustrating for physicians and patients is having the third party in the room with us, in that room, and that's their payers, whether it's the government through Medicare, Medicaid, or a private insurance company. The third party is causing a lot of interference in me taking care of the patient.
According to Pearl, this interference between patients and doctors is dictating medical treatment, sometimes against the physician's wishes.
The doctor no longer has control over the best care regimen for the patient because now the insurance company is telling the doctor how they are going to take care of that patient.
What medicine you can take, what tests you can have, what treatment you can receive, it's all being legislated to both the doctor and the patient now.
Our healthcare system needs to change and evolve. I mean, I do agree that it's broken right now.
While over 32 million uninsured Americans will gain access to affordable health care by 2014, many face the threat of higher insurance premiums to cover funding losses. Jay, back to you.